While pretty much everywhere you go around the world, racism exists and it's bad. It is literally killing us. A new study in the Lancet had some pretty amazing statements I would love for everyone to be aware of, but this is the sort of news that nobody pays attention to. That said, racism and discrimination are fundamental drivers of health disparities worldwide and must be universally acknowledged as a public health threat, saying that racism and xenophobia exist in every modern society and have profound effects on the health of disadvantaged people. So what did they do? They did a study of 2 million pregnancies across 20 high income and middle income countries. They looked at neonatal death, stillbirth, and preterm delivery, and they found that all of those things were more likely among babies born to Black, Hispanic, and South Asian women. But beyond just that, they looked at the effects of, in some cases, institutionalized racism in a variety of different areas, saying that the theft of land and destruction of traditional practices of indigenous Brazilians are associated with adverse cardiometabolic outcomes. They looked into cancer as well, saying that among people diagnosed with brain tumors in the US, Black patients were more likely to have recommendations against surgical resection, regardless of clinical, demographic, and socioeconomic factors, suggesting bias in clinical decision-making, which we know exists. Over in Australia, everyday discrimination contributes to half the burden of psychological distress experienced by Aboriginal and Torres Strait Islander peoples. And in August, it was revealed that Black and Asian people in England have to wait longer for a cancer diagnosis than white people, with some forced to wait an extra 6 weeks. Overall, they find that minority ethnic patients wait longer than white patients in 6 of 7 cancers studied. So it's psychological effects, it's effects on childbirth, it's cancer, it's bias, it's wait times. It's a lot of different things combining in societies across the globe, JR. JFC.
Yeah, of course, right? So these biases, I always said it crosses all these parts of our society. Police officers, once they go and put on their badge and put their gun, they're just other members of society. So when they're not working, they still get influenced by all these thought processes, doctors, housing, jobs, all these things. So after there's this perception that minorities are people that they're looking to keep down, or I guess naturally have their biases against, and they consider them lesser people, yeah, there's lesser opportunities, there's quicker death, there's worse jobs, and it becomes a self-fulfilling prophecy. Yeah, if you treat certain people horribly as a society, more so than everyone else, they're gonna be at disadvantage, and then you can say, look at how much they don't do the right thing. Hey, the power structure keeps certain people down, and then you get your biases fed right back to you, and you're galvanized in your hate. Yeah. Something needs to get flipped upside down, and those in power have to be the ones to start recognizing it. That's the problem.
100%. People in the chat are talking about the effect of socioeconomic status, which yes, is definitely a part of this. And by the way, everyone, you can go to the actual study, the Lancet study, you can find out a lot more about this. This is great write-ups as well. But bear in mind, as I said, in some of the cases, they're controlling for that. They're saying that the bias in medical advice, they're controlling for poverty and all of that. And you still find it, even amongst people with similar levels of income and wealth. But finally, they say, the logical conclusion is that racism and discrimination must be central concerns for practitioners, researchers, and institutions to advance health equity. And they provide some recommendations saying, increasing cultural safety and diversity in the healthcare workforce, working with affected communities to achieve healthcare systems that are more flexible, accessible, and welcoming, and strengthening indigenous self-determination and land rights. But the issue here is that you need to have individuals change, because some of this bias it's a psychological predisposition, like that's an individual thing. They also, you can affect the training of doctors and people who manage insurance and things like that, scheduling, that can help. But you also have to change governments too, because a lot of this distress that they're talking about, especially for indigenous peoples, is the result of actual government policy. And so just as in the same way that this study is covering societies from across the world, we really have to go across the entire system, from the individual up to the structures that govern how people live. Those are going to need to be changed basically in every society to avert some of these outcomes. For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/thedamagereport. And you can ring the bell wherever it is so you don't miss anything.